Pulse 95.
It is Life Beats here on Pulse 95, and there are some incredible statistics when it comes to back pain, because 90% of acute lower back pain issues can be resolved within 6 weeks, but you'd be surprised to know that everyday activities can reduce back pain, and one of the worst things that you can do for back pain is in fact to sit at your desk. It can be just as bad as a sports injury on your back. To tell us more, I'm very pleased to be welcoming into the studio physiotherapist Dr. Mohammed Hamad from University Hospital Sharjah. Welcome.
Thank you so much.
Really great to have you with us, Doctor. Now, when you kind of sent me what you wanted to talk about here on the show, I was really quite surprised by a number of things. Obviously, back pain is one of those things that is very common for people. And you're a physiotherapist who is specialized in pediatrics, in sports injuries as well. But you're telling me that most people who come to you, actually, the problem is just the way that we sit for long hours at our desks every single day. Tell me about this.
Morning to all our viewers, first of all. Yeah. Most of the cases, suppose say 70 to 80% of the cases that we are seeing in University Hospital Sharjah is because of the postural back pain, is because of the habit that we are using on a daily to day-to-day basis, right? We need to take care of our back by using certain things like how we are going to sit, how we are going to take care of our postures, right? And how much time we are taking a break in our daily work.
What is actually sitting, at your desk for long hours do? What is it doing to your spine, and what is it doing to your back?
See, first of all, our back is curved in a 4 different shapes, right? So if you keep on sitting for say 2 hours, 3 hours on a continuous stretch basis, what's going to do, it's going to strain more and more strain on your lower back, especially. And if your neck is not supported while sitting, that's going to take a toll on your neck as well. So what happens, your muscles starts getting overstressed because of the continuous sitting posture for a longer period of time. And at the end of the day, your back is going to take toll. And it's not a one-day process, mind you. It's going to take some time, maybe 4 months, 5 months, 6 months. Then you will start complaining of the back pain, right? Sometimes you will find a person who will just come to say, I was just bending my back and my back just catch up. It doesn't happen in one day. It happens because of the posture that you acquired for a longer period of time.
So it can manifest itself when suddenly you go to try and pick up something,
yes,
or you bend a certain way.
Yes.
And exactly as you're saying, Doctor, you feel like it just suddenly came.
Yes.
But actually, it's not a suddenly thing.
It's not a sudden thing, mind you. And first and foremost, that pain that you are complaining on a daily basis, that's actually a symptom. So it means something is going wrong in your back. So first and foremost, you need to see the surroundings in which you are sitting in, on the surface which you are lying down. You're putting up the whole night on what kind of surface you are lying down, right? What kind of activities you are more involved in. Suppose you are a mechanical person. Suppose you are a person who is in the job of more forward bending, or lifting up the weights, lifting up the things, right? If you're a software professional, how much time you are sitting in your job? That really matters, right?
At least 8 or 9 hours a day, most of us.
Just imagine 8 to 9 hours a day. Initially, it's okay, right? For 1 year, 2 years, it's fine. But later on, those 8 to 9 hours of continuous sitting is definitely going to take your toll onto the body, especially your lower back. So that is why one of the major reason is of the low back pain nowadays is our bad posture. And whichever industry you are in, you take an example of dentist. The dentist is just bending his back for 7 hours, 8 hours, and he's treating the patient. End of the day, what's going to happen to that dentist? Just imagine.
Wow.
Right?
So, okay, so in terms of most of us who are not dentists, who are sitting at our desks, what are those things that we, need to be thinking about? And, as well as those who are kind of bending over for long periods of time, what are the things that we need to be mindful of? Because a lot of this relies on our knowledge of anatomy and understanding the body. So what do we need to understand about the body that we don't know?
First and foremost, try to be more flexible. try to be more mobile. Don't just stay in your desk for a longer period of time. That's the bottom line.
What's the maximum you should be spending
Every
at a
30
desk?
to 40 minutes, take a gentle 5-minute stretch of your body. Just take a gentle 5-minute break. Roam in and around your working station. I'm not asking you to just go out, right? In and around of your working station. Just make a few walks, few steps. You can stretch your back, you can stretch your shoulders, you can stretch your hips, you can do whatever you want.
Just move.
Just move yourself, please. That's the bottom line. The more you'll move, more it'll be better. Now, there's a strong myth in our place. It's like, once you had a back pain, you should not move.
Okay, exactly, because you think, I'm going to do something to my back.
Right. In 90% of the cases, except in some traumatic injury, you should move. You should move at any cost. More you'll move, the more the muscle is going to be flexible.
That is so interesting because, being someone who had surgery on my foot,
Right.
and it was painful on my knee, and I was thinking, if I move, that hurts, so I'm not going to move. But actually, it's the complete opposite. You have to move
Yes.
to bring the muscles back.
Exactly. And the more you will move, see, our bone will become stronger once the weight is going to come onto that bone. This is
Right.
how our anatomy works. Right?
So it's the opposite of what we think.
Yeah, that's what we think. That's the myth in our place.
Right,
So we need to break out these kind of things.
So we need to put that.
You need to stretch. You need to move. You need to flexible.
And there are all kinds of different exercises that you can do that are gentle stretches. And so you need to build up that strength over time, don't you?
Absolutely. See, you need to evaluate. You need to evaluate yourself. And if you're not gonna, you're gonna think you need to have a counseling, you better have a counseling with one of the physiotherapists. All right, that's the best way to do. Because you are complaining of a back pain all the time. You're complaining of a neck pain all the time. You should better have one counseling session with a physiotherapist. Now, the physiotherapist is the person who is going to help you out in assessing, all the tools that he had. And then, as per the need, he is going to prescribe. He or she is going to prescribe you.
People can get a little bit confused about exactly what a physiotherapist does.
Okay.
So what would the kind of treatments be that a physiotherapist can offer?
Right. Physical therapy, basically, it's a branch of medical science which helps in restorations, functional and mobility of the persons according to the need. And it depends upon the patient's history, whether it's an aging process, whether it's a sports injury, whether it's a post-operative surgery. It depends. And we have, as a physiotherapist, we have a customized physical therapy program to each and every individual conditions. So suppose if you're seeing a pediatric patients, a child patients, we see a child as young as 1 month old child.
You've currently got a patient who is actually 1 month old.
Right. And she is in a severe respiratory distress. But what we are doing from our side is just to making her lungs clear, less secretions, so that the breathing should be more and more.
So this is so interesting because I want to come back to this in just a moment, Doctor, and talk about this because it is not just back pain. It is not just, your muscles that need working out or need help or the skeletal system. But there are other issues as well, like the respiratory system, that can benefit from physiotherapy. So I want to come back in just a moment with you, Dr. Mohammed Hamad from University Hospital Sharjah. We are going to be talking more about physiotherapy, why we need to be moving more, and even talking about kids, how kids can benefit from physiotherapy, how the elderly can, how pregnant women can in fact benefit from it too. All of that to come on Live Feeds on Pulse 95.
From the heart of Sharjah, Pulse 95.
Ramadan Mubarak from all of us at Pulse 95.
Sharjah, a city of firsts. Did you know?
In 2017, QS World Universities rankings placed Sharjah among the top 100 student cities in the world.
And did you know?
The Sharjah International Book Fair, which started in 1982, is the fourth largest book fair in the world.
Sharjah, a city of firsts.
Climate change. No nation on Earth is immune to it. Something to think about.
How often do you shop online? Yes, it's convenient, but does it cause you to actually use your motor vehicle less? Online shopping is so commonplace in many parts of the world. Statistically, it's starting to have a serious impact. Mainly the astronomical amounts of delivery trucks ferrying ordered packages to customers, and therefore a disproportionate amount of pollutant emissions.
Climate change is not only about climbing temperatures and abnormal weather patterns.
Discover the cold facts of climate change.
The power of the written word. Great authors, classic quotes, and greater books.
Without words, without writing, and without books, there would be no history. There could be no concept of humanity. Herman Hesse.
Want to stalk our presenters? Befriend us at facebook.com/Pulse95 Radio. Pulse 95. Life Beats with Sally Musa, only on Pulse 95.
We are back with Dr. Mohammed Hamad from University Hospital in Sharjah. We are talking physiotherapy and the benefits of it. And it doesn't even just have to be for back pain. There are other situations that physiotherapy can benefit people. And it's not just adults as well. This is for all ages. You're talking, Dr. Mohammed, about a patient that you currently have who is just 1 month old. Tell us about her story.
She was born with some severe respiratory distress, and apart from the other complication, she has some breathing issues as well. As a physiotherapist, we need to maintain the clear airway, and for that we have certain manipulative therapy, some manual therapy that we need to continue on through that baby. And that baby is one of the example. The physiotherapy in general is for every age bracket, right, from infant to as old as 100, you can say that. So it depends upon the conditions, it depends upon the age, and it depends upon the requirement. And apart from that, the infrastructure under which you are working, that also really matters as far as the physiotherapy services are concerned. And we are pretty much blessed. We are working in a university hospital under the guidance of Mr. Ali, he is our CEO. He is providing one of the best infrastructure as far as
the best facilities there at University Hospital.
Absolutely.
For sure, 100%. But, I want to kind of continue with looking at these kind of conditions that you don't think it could possibly have anything to do, with the muscles, with the skeletal system, or with what's going on there. There are other issues going on. You've got one patient who came to you at a year old with collapsed lungs.
Yes.
Tell me about that.
Yeah, she was transferred to our hospital when she was as young as 1 year, and she has one of the congenital disorders in which the lungs got collapsed. In a layman language, we can say that. So apart from being taking care of her chest has a lot of issues. Apart from that, she was unable to breathe on her own. She's on a ventilator all the time. But apart from this also, there is some developmental delay milestones are there that we need to take care of that. And from the intensive physiotherapy, things are much in control now. She's as chirpy as her age really allows her now.
That's amazing.
Yeah.
That's incredible. And that's through exercises that you get her to do as well. But talk to us about more common situations that you see children in. Is it sports injuries that children come to you with? What kind of cases do you see?
Almost 10% of the total OPD in our hospital, as far as the physiotherapy part is concerned, is for the pediatrics, to be honest, in our OPD. Yeah, and in that, you can say 50% is for the sports rehabilitation, and 50% comes from the delayed developmental milestone.
Delayed developmental milestones.
The patient with the special needs, we can say that. The patient who had the baby who had some birth deficits when the birth was there. So the patient is having delayed developmental milestones.
For example, tell us what kind of developmental milestones you're talking about here.
Yeah, see, suppose the baby is of age of 3. Suppose she should walk, she should run, right? But she has crossed that age, but she's still onto the bed. She or he needs activities of daily living to be monitored, to be taken care by the parents. So it means that milestone has been delayed, right? The baby should be walking and running by that time, but she or he is not able to do that.
So this is where children of special needs are concerned.
Yes, and in that case, the physiotherapy comes to a major role.
You talk about intensive therapy in this kind of situation. What does that mean exactly?
Intensive physiotherapy here in this case means you need to take care not only to the musculoskeletal part. It's more kind of holistic approach that we need to take care of. So you need to educate the parents. You need to educate the caregivers. You need to take the proper positioning of the body parts, which might goes into the deformity because of the disuse of the muscles.
Wow.
Right?
How quickly can muscles, I guess, atrophy or, go into deformity if they're not used in the right way?
See, as per God, to be honest, we should be walking by 1.2 years, right? So our body is made up like this. We have to be in an upright posture all the time. If you're not going to do that, your body is going to be disused. The muscle is going to be atrophied, right? And this happens pretty fast. This happens pretty fast. We might have seen all the things around also in our home, in our surroundings. So the patients with the old age, they goes into the bed, they don't move what happens then? They start more lethargic, and at the end of the day, you can see there is no muscles, this complete wastage of the muscles. So it's kind of the mobility that is required.
We're going to talk a little bit later on about, what it means, because we think that that's just normal. As you get older and older, that you are supposed to move less and less. But actually, that isn't the case.
That is a myth.
That is a big, big myth.
That's a myth.
Which we are going to come back to and talk about. But, in terms of kids with just general sports injuries, what do parents need to know to prevent injuries to their kids, whether it be, sporting injuries or otherwise?
First and foremost, the parents needs to take care of the child, posture, the maintenance of the body, right? They should observe keenly whether the child is not falling down frequently while playing sports, whether the size of the shoulders are properly equal or not. You need to keenly observe that. And if you had any doubt regarding the child's posture, regarding the child's frequent fall, here, the parents needs to take care of that by visiting proper orthopedics.
Are we talking about like slumping?
Yes.
Are we talking about what kind of posture? What kind of things should they be looking for?
It might have happened because of some muscular injury before. It might have happened because of some birth deficits.
Yeah.
It might have happened because of some limb length discrepancies, right? And sports injuries is one of the most commonest factor nowadays, especially with the children.
What's the biggest kind of sport that you see causing injury?
Yeah, especially in UAE, people love football. Right?
Yes, of course.
Right. So the most of the cases we'll find is kind of ankle injury and the knee injury. Right. And we need to take care of that right from the day one, right from the beginning. Because if it's not going to take care of that, it's going to be more chronic. Then you will have frequent fall. You will have recurrent injury. You can have recurrent ankle and ankle dislocations, ligamental injuries. All right. So once the injury has been done, take a proper investigation, have a proper consultation, and you need to go for the rehabilitation.
Can we take preventative measures to
Absolutely we
stop
can.
these injuries from happening?
Yes,
What can we do?
We need to take proper care by learning certain exercises, right? How you are going to take care of your ankle and your knee, especially during the course of sports. And first and foremost, you need to take care of your body, especially if you're in the sports. You need to know when to warm up your body, when to cool down your body.
Make sure you warm up and cool down.
Make sure you have to warm up and make to cool down the body during and after the sports. Because that is one of the most important things. If you're not follow this, you're bound to happen recurrent injuries all the time.
We're going to come back in just a moment and talk about some of the mistakes that we make every single day. Talk a little bit about pregnancy and back pain as well. We have a question here about that, and so much more. Talking about, what does it mean to be elderly, but also moving freely, being mobile and enjoying later life as well. How do we do that with physiotherapy? That's all next on Life Beats on Pulse 95.
Life Beats. Life Beats with Sally Musa. Only on Pulse 95. See all our pretty pictures at Pulse 95 Radio on Instagram. Pulse. This is the Pulse 95 Business Update.
Sharjah Economic Development Department, in cooperation with the Sharjah Business Women's Council, organized a workshop under the title Develop Your Business Through E-Commerce. The workshop targeted a number of female entrepreneurs and owners of projects using social media and electronic platforms. Chairman of Sharjah Economic Development Department said that e-commerce and e-marketing represent one of the main objectives the department has been working on over the past 3 years, with the aim of expanding the geographical horizons for the citizens' pioneering projects. He added the initiative comes in line with the adoption by the government of Sharjah of digital transformation, which opens the way for citizens to obtain the electronic trading license, provided that the applicant is a holder of a no objection letter from the Telecommunications Regulatory Authority.
Business Update.
The Pearl Initiative, an independent non-profit organization promoting a corporate culture of accountability in the Gulf region, signed a memorandum of engagement with Enoch Group, highlighting its commitment to enhancing corporate responsibility and transparency in the region. Through this partnership, PI and Enoch seek to gain advantage from each other's experience in the area of corporate governance, commit to jointly promoting ethical behavior and business practices, including transparency and accountability, in addition to investing in initiatives that stimulate social entrepreneurship in different markets.
This is the Pulse 95 Business Update.
The Ministry of Economy said that retail companies were committed to reducing their prices during the holy month of Ramadan, as well as decreasing the number of consumer complaints and offering discounts of between 35 and 75%, according to the ministry's plan. During a consumer protection monitoring tour in the retail stores in Al-Wahda Mall in Abu Dhabi, Director of the Ministry's Consumer Protection Department said the ministry had not recorded any pricing violations since the start of Ramadan. He also expressed the ministry's happiness at the discounts offered since the start of the holy month, which increased consumer satisfaction.
Business Update.
IBS Software, Indian-based global provider of end-to-end software solutions to airline and travel industry, sees great potential in working with Gulf-based airlines to migrate to next-generation technology platforms. Executive Chairman of IBS Software said the company is currently in discussions with leading carriers in the Middle East, including Emirates Airline, Saudiya, and Oman Air, to provide digital solutions for their flight and crew operations, customer loyalty, and cargo management. He added IBS, which last month inked a contract with Etihad Airways to replace the airline's existing network control system and develop a hub management system, is also in further talks with the Abu Dhabi Dubai-based airline about modernizing its cargo operations.
Pulse 95.
From everyone here at Pulse 95, we wish you a Ramadan Kareem.
Pulse 95.
Pulse 95. The heart of Sharjah.
The heart of Sharjah.
Can you guess what dish these ingredients make?
Chickpeas, fava beans, olive oil, parsley, onions, garlic, and lemon. What does it make? Hummus, fool, or falafel?
Invite 6 of your family or friends this Ramadan by guessing the dish. All Ramadan, go into the draw to win at Sheraton Sharjah Beach Resort and Spa. Tune into Yalla Home with Anna and Big Hass weekdays from 3 p.m. Guess what dish the ingredients make? SMS the correct answer to 4215 and your family and friends will be dining at Sheraton Sharjah only on Pulse 95.
The beauty and joy of Ramadan. Discover why.
When the month arrives, it brings a heightened sense of community with it. Muslim families often wake up together before sunrise for an early breakfast. They also invite each one another to break their fast together. This tradition creates friendship and stronger ties among neighbors, families, and friends.
Mubarak alaykum, Shahr Ramadan. May the month of Ramadan be full of blessings.
This is Sharjah Quest. Sharjah Quest. In search of the city's most interesting attractions.
To step into Sharjah's old souk is to enter a bygone era. Wonders of art abound too, with many art galleries, special art-related activities throughout the year. And the Art Museum features a permanent display of artwork from His Highness Sheikh Dr. Sultan bin Mohammed Al Qasimi, member of the Supreme Council and ruler of Sharjah. The Sharjah Old Souk, a marketplace of memories. Find out more at heartofsharjah.ae.
Sharjah Quest, discovering fascinating sights of the city.
Another good read for stories and ideas that jump off the page.
Unconditional Love, a guide to navigating the joys and challenges of being a grandparent by Jane Isay, is a wise guide, but without being too sentimental. Dealing with the conflicts of family life once grandchildren enter into the picture, and how family relationships change, it debates finance issues, technology, and the reassuring idea that loving relationships don't require constant proximity. Steeped in psychology, Unconditional Love is a wonderful compass to a new phase of responsibilities for grandparents.
Turn the page on another good read from Sharjah, World Book Capital 2019. Oh no, my friends and family have missed out on the morning majlis. What can they do, Anna?
Don't worry, they can catch up with any of the Morning Majlis episodes by checking out soundcloud.com or
Apple Podcast.
Life Beats. Life Beats with Sally Musa. Only on Pulse 95.
We are with Dr. Mohammed Hamad Raza from University Hospital Sharjah. He is a physiotherapist, and Dr. Mohammed, we've been doing some exercises in the break to make sure that we get up out of our chairs. You did say every 30 minutes. We've just come halfway through the show, and we have to get up and do that. You've been asking me to do some lunges. We've been twisting our torso as well. That's very important.
Along with the stretching of your upper and lower limbs.
Yes, stretching of the upper and lower limbs.
Really helps, because if you're just sitting on a longer period of time, your muscles starts getting more and more stiffer.
Yes.
So you need to just stretch those things,
Absolutely.
The blood flow will increase, you'll feel much better. Flexibility is the bottom line.
It does make you feel better, that's for sure, when you come back to your chair.
Yes.
You feel like you come back fresh, which is brilliant. I love that. But Mariam actually has written in with a question because she's heard us talking about sitting at the desk for long hours, and she's asking about the kind of office furniture that she should be buying. She says, I have a chair that it is an office chair as per se, but it doesn't feel that comfortable, and I do feel back pain when I sit in it. So what can Mariam do in this regard?
See, as far as these parts are concerned, there is ergonomically approved chairs, office accessories are available nowadays. End of the day, you need to just take care of 2 to 3 things that really matters if you're going to sit for a longer period of time onto the chair. Number 1 is your neck support. Number 2 is your back support. And number 3 is your shoulder, elbow and wrist support, along with your foot and the hip positions while sitting down. Okay, your hip and knee should be at the 90 degree. Your foot should not be dangling, right? Your wrist should always be supported onto the desk. Your back should always be supported, especially your lower back. Your cervical spine, your neck should always be supported. You should not always be slouching, or you should not always be just putting yourself forward onto the desk. Just try to keep upright posture as much as you can.
You have to be straight.
30 to 40 minutes. Take an even amount of breaks during your course of day-to-day job. Things will be much in control, along with the stretching and flexibility exercises. That's it.
So in terms of like a neck rest, what does that look like? What if your chair doesn't have a neck rest?
Like if they are not providing you any kind of neck rest, then I'm afraid to say it's not a kind of ergonomic chair that we are looking for. So there should be a neck support for the chair. If you're going to sit for a longer period of time, it has to be.
And your hips and your knees at 90 degrees.
Should always be at the 90 degree while the course of sitting.
Yeah.
Provided your ankle should not be dangling above from the foot. Should always be firmly onto the ground.
Okay. Yes. All right. I hope that helps there, Mariam. Something that I want to ask you about as well is men and women. How men and women experience things like back pain differently.
Well, it depends. It depends upon the work profile, and it depends upon the amount of work they are doing nowadays, right? So, suppose a woman is a homemaker. She's just bending more of her back all the day. She's taking care of the kids. She's taking care of the house. She's taking care of everything. So she's more into the forward bending posture all the time.
Shout out to the moms. It was Mother's Day yesterday. Yes,
yes,
exactly. Who are doing all of that, all of the bending, picking up the kids, putting down the kids.
Yes.
Yeah.
So they will experience different kind of pain. They will feel more pain when going for the forward bending posture. And if you're sitting more into the upright postures, or you are just extending your back backwards, you'll feel different kind of pain. Sometimes the pain comes below to your hips, below to your knees, all to the ankles. Sometimes you feel more pain of a localized pain. So I must try to emphasize this. It's not a gender kind of pain nowadays. Like a woman will feel a different set of pain and a man will feel a different set of pain. It depends upon what kind of work you are into.
Right.
You are more into the forward bending posture work, or you're more into stiff back. That depends really.
And what about when you have pregnancy? Because a question came in from Nancy earlier. She says, I'm pregnant with my 3rd child, and every time from the 3rd trimester onwards, I start experiencing lower back pain. What can women who are pregnant do about, because it feels like it's inevitable that you're just going to have lower back pain, you're going to be uncomfortable. It just you think you can't really do anything about it, can you?
Absolutely, we can. First, let me give an answer to Mrs. Nancy. Why she's complaining pain only during the course of a third trimester, and that too now she's having a child, alhamdulillah, third child, right?
Yes.
So thing is, once the woman comes into the third trimester, the abdomen start bulging more and more, right? So the gravity always starts pulling you down.
Yes.
Just because your abdomen will become more heavier, you'll feel more strain at your lower back, because your lower back is counter-affecting that force from the gravity, right? Just to make your upright posture. So that's the reason why a patient like Nancy always complain more pain when she comes to the third trimester. Now I'll talk in general what we have to do in general. There is a certain courses of things that we need to take care of is antenatal and postnatal care. Yeah, antenatal care and postnatal care. These are the part of the physiotherapy sessions that every pregnant woman should opt whenever she is pregnant. And especially in a facility like us, in UHS, we provide these kind of courses just to counsel the patients, just to make sure that all thing goes well even after the delivery as well. So just need to condition the back muscles. You just need to.
So how do you do that? How do you condition the back muscles, and what's the difference? The antenatal versus postnatal.
See, first and foremost, one of the myths of the being pregnant is you should not lift weight, you should not bend forward, you should not do this, you should not do that. Cut out all this myth. Woman should be as much flexible as she can till the time of delivery.
Keep lifting weights. Keep walking.
Keep walking. I'm not asking her to keep lifting the weights.
Yeah.
But keep walking.
Yeah.
Keep yourself more flexible.
But even light weights, surely they're beneficial.
Absolutely. More beneficial. Especially for your abdominals, for the lower leg. Because in the third trimester, you are going to take extra weight apart from your body weight.
Yes.
Right?
Yes.
So you need to take care of that as well.
You're likely also holding the child that came before as well.
Right. Absolutely.
At that time. Right. Yeah.
So all these things will be taught in your antenatal and postnatal care. Antenatal care is pre-delivery and postnatal care is after the delivery.
And in terms of, I know you can never get comfortable. Like you can't sleep. It's impossible to sleep well.
Yeah. In that thing, we actually teach the woman how to do the positionings while the course of sleeping, while the course of sitting.
Do you need a special pillow? How does that work?
Yeah, we do provide this kind of advices to the patients who comes in our department.
Okay, yes. All right. So tell us, how does a pregnant woman need to sleep? With pillows between the knees, or?
Should always try to keep the pillows in between both the knees.
Okay.
Okay, so that's gonna help because your hips are not getting joined, your knees are not getting joined, right? Plus, always try to be more into the side lying posture. Whenever you are trying to get up from the bed, always make sure you try to make it turn and then get up. Because the more you will come in an upright posture while coming out from the bed, the more it's going to hurt your back, especially with the pregnant woman.
So do a slow kind of...
Always make a side turn.
Side turn.
Always make a side turn and then take a support from the elbow and then get up.
And then get up.
Instead of you just coming up to the bed directly.
Good advice. Right? Good advice.
Don't sit onto the lower surface chair and all. Because the more you'll sit onto the low-lying surfaces area, the more it's going to take weight on your knees and your hips to get up.
Yes.
Because you are carrying extra weight, mind you, right? So always try to sit on an upper surfaces area where you can take less weight from the body and you just get up.
I love it.
So these all things really matters.
Really good advice. If you are pregnant, if you're expecting, or what to expect to make sure that you are as comfortable as possible. I feel like, the biggest thing, in all of this is to just keep moving.
Keep moving.
It doesn't matter where you are, at which stage in your life, you've got to keep moving. And we're going to come back with you, Doctor, in just a moment and talk about two things. Being elderly as well, and obesity. And so how both of those can benefit from physiotherapy. More to come right here on Life Beats on Pulse 95.
This is Pulse 95.
Beauty and health tips. Beauty and health tips for the modern woman. Modern woman. Presented by This Modern Woman.
Lovely ladies, electrolytes are chemicals that form electrically charged particles or ions in body fluids. When you sweat too much, you can get cramps because of the lack of electrolytes. For adequate rehydration, the body will look to charge from the water you drink or the food consumed. Choose foods high in electrolytes. Load up on vegetables and fruits. High potassium fruits include bananas, dates, raisins, coconut, and avocado. All good, yummy stuff.
More pearls of womanly wisdom. Womanly wisdom. Coming soon.
The rules of the road for better road safety.
One of the most dangerous driving weather conditions is smog or fog. While driving in low visibility, use low beam headlights instead of high beams, which hinders the vision of oncoming traffic. Fog or cold can cause the formation of moisture over windscreens. If this happens, slightly roll down your windows or use the car's interior window heaters to quickly clear the moisture.
Road safety tips, making our roads less dangerous.
Influence from Islam's golden era. Brilliant minds that inspired the future.
Ibn el-Baytar was the most credited botanist of the Islamic Golden Age. His work in the field of medicine was acknowledged and followed for centuries. One of his most famous texts was Compendium on Simple Medicaments and Foods. In this pharmaceutical encyclopedia, Ibn el-Baytar lists 1,400 plants, herbs, and foods. Over 300 were discovered by him, which he researched methodically, then giving specific guidelines for their usage in medicine.
Want to talk?
Call the Pulse 95 studio.
Dial 600 551 449.
Pulse.
Life Beats. Life Beats with Sally Musa. Only on Pulse 95. 95.
We are talking movement. We are talking physiotherapy. We are talking the kind of treatments that can help you live a much more comfortable life. And it all starts with getting moving. Very, very important with Dr. Mohammed Hamad from University Hospital Sharjah. He is a physiotherapist. And as we were mentioning earlier, Dr. Mohammed, when it comes to the elderly, we always think, okay, the older you get, the less you're going to move, and that's just how life is. And you say this is another myth that we have to stop believing.
Absolutely. That's another myth. Unfortunately, in our society, we are still carrying that.
How do we keep active? How do we keep up?
First and foremost, it's also a kind of holistic approach.
Yes.
First and foremost, patient needs to be motivated. Motivation is the most important aspect in making elderly move. We need to motivate. And how are we going to motivate? We're going to motivate by counseling, by indulging that patient in a group therapy. That is also one of the best way to rehabilitate the older people. If the patient is, suppose the patient is aged somewhere around 70, 75, he loses the charm of moving outside, doing some sorts of things that he should be involved. So let that person be involved in a group therapist that we provide. Right? In that we just focus on more into the flexibility kind of exercises, into a minimal gym activity exercises, just to make them feel good and just to move them out from the bed, right? We just need to rehabilitate the muscles that is required for them to keep on moving, to make the posture in upright, right? Because the more they will move, the less the deformity, the less the disability will creep up. Right, and it's good for the patient. It's good for the patient's family as well.
I love what you said. It's quite holistic. It's not just about their physical being, but they need to be connected to other people.
Absolutely.
They need to establish those relationships, which then motivate them to get outside, to be more active, to do what they need to do.
Absolutely.
It's all about getting excited to do it.
Absolutely. You need to create that kind of zeal into the older people. Because the more they will be motivated, more it will be better for them and better for the society.
Because what's interesting, we see there are people who they're into their 70s, 60s, 70s, and they're weightlifters, and it's just like, whoa, is this possible?
Absolutely, it's possible, and there are so many motivated stories in and around the world. right? And it is possible. Why not?
So if you are somebody who, maybe doesn't move as much, is it just a matter of, as you said, finding that motivation and then starting little by little and building up the strength? Is it still possible if you're in your 70s now and don't move very much to be able to get back into it?
It depends on not only about this factor, it depends upon some comorbidity factor as well. Like suppose your lifestyle, how was your lifestyle before also? Suppose you are mostly into the sedentary lifestyle, right? Suppose you are an obese. Now obesity is also one of the major issues as far as this country, Sharjah is. There are almost 5 to 10% of the total population is suffering from obesity, which is pretty huge in an amount of person who's living in Sharjah. So obesity is also one of the major factors. We need to take care of that. Plus your comorbidity factors like hypertension, your sugar, that is diabetes mellitus. These all things are the factors which actually creates an issue with the patients who crosses the age of 60 or 70. Because on those patients, the metabolism doesn't work that much better as compared to the other groups. So for that, we need to be motivated to just continue with the exercises, follow up the regime. In that, the discipline that really requires how much time you should give yourself for the self exercises. That really requires. End of the day, the more you will be mobile, the more you will be, in kind of forward moving postures all the time, more it will be better for a patient like this. And the second thing that we are facing a problem nowadays is obesity. Obesity is also is a kind of lifestyle disorder, I must say. And one of the major issues right now is those all junk foods, how your fooding disorder is, your time of your food. These all things really matters. Sometimes the post-operative complications also leads to more weight. Sometimes medications side effects leads to these kind of things, these obesities. So we need to take care of that also. And we are running a proper regime to take care of these kind of things in our hospital as well. We have that kind of infrastructure that we do take care of these kind of issues as well in our hospital.
So people are not just talking to a physiotherapist, they're also talking to a nutritionist. They're looking at all of the different factors that can contribute to their condition.
And basically this is a teamwork. Basically this is a teamwork, and this requires nutritionists, this requires physiotherapist, this requires in a severe obesity we require a bariatric surgery as well. Right. And it requires endocrinologist, because there might be some kind of endocrine disorders that leads to obesity also. So it's kind of holistic approach where everybody needs to put in. But end of the day, patient really matters. How he or she takes care of his well-being.
How they're going to take care of themselves.
Yes, that really matters.
It's number one, how we treat ourselves,
Absolutely.
isn't it?
We need to love ourselves.
We do. It is Ramadan, so Ramadan Kareem to you. And I just kind of want to end off on, the idea. I saw this a couple of years ago, in fact. When we do the salat, the prayer, the Muslim prayer, it's very physical. You're up, you're down, you're straight, you're, at 90 degrees, you're doing all kinds of things in there. And something that I read said that it had a lot of benefit for the body. Can you talk to us a little bit about the benefits of the physicality of the prayer?
Absolutely, I'd love to. Okay, let's keep spiritual part apart.
Yes.
Right?
Yes.
In the salah, what we are doing, we are just bending our back, extending our back.
Yes.
Right? Moving our hips ups and down. Right? So end of the day, you are mobilizing yourself. So once you're mobilizing yourself, your muscles are going to stretch, your muscles are going to lengthen, your muscles are going to shorten in one particular posture. Suppose there is a posture called sajda.
Yes.
Right? In sajda, what do we do?
It's the prostration.
Yes, that's basically a stretch.
So basically, you are down on the floor,
Yes.
on all fours.
On all fours.
Your hands are on the ground. Your
Right.
head is on the ground.
Right.
Your spine is kind of stretched
Exactly.
out.
That's what you do. You are stretching your lower back.
It's almost like a yoga pose, isn't it?
It's kind of.
Almost.
Kind of. Let's not compare one thing to another.
Yeah.
Let's focus on Salah.
Yes.
It's more of a kind of stretching exercises that we are doing, right?
Stretches out the back.
Stretches out your back. Once you are into the ruku, then it has a different effect.
That's when you're on your knees.
That's when you're on your knees.
Yes.
Now you're keeping your spine straight.
Yes.
Right? So both your abdominal and your back muscles are working in a core.
Yeah.
So you're strengthening both the muscles,
Yeah.
both the group of muscles.
So you're standing and you're kind of at 90 degrees in the ruku'. So basically, you're bending your back.
Yes.
We always got told when we were little, you have to keep it straight, like a table.
Exactly. So because the more you will slouch, the more the abdominal muscle will work. That's create a bad posture.
Wow.
So that's why, as you just now told, you're advised not to slouch yourself down.
When we were little,
Yeah.
that's what we were told. The
So-
adults, when they were teaching us,
Yeah.
they would always say, make sure you don't slouch. But that's incredible. That is amazing. And what a great conversation. Thank you so much, Dr. Muhammad. What a wonderful show with you today.
Thank you so much.
And this will be on the podcast in case you missed any part of it. Then do go to our SoundCloud, Apple Podcasts, and everywhere else that you get your favorite podcasts.